Welcome everyone to the information session for our graduate programs in spatial analysis for public health. Getting ahead of ourselves. My name is Morgan Fredericks, and I am the admissions officer for our program, and I will let our program directors introduce themselves.
Hi, everybody. My name is Frank Curriero. I am a professor in the Department of Epidemiology at Johns Hopkins Bloomberg School of Public Health. My degree is in statistics. I sit in the epi department, sort of kind of getting closer to the data in a sense. I've been working in spatial analysis now for 25 plus years. And Tim and I together put this program in place about 7 years ago. And it's a great program. I'm going to talk to you a little bit about that today. I'll stop here for now and let my colleague Tim introduce himself.
Thanks, Frank. As Frank said, I'm Tim Shields, also in the Department of Epidemiology, also in the Spatial Center for Public Health with Frank and others here at the school. Been at Hopkins for 25 plus years doing spatial analysis. And I come from a geography background. So I'm more of the mapping component of this, but it's great to integrate all of these things together. But we'll let Frank get back to describe the program in better detail.
And then Frank, would you have the honor of introducing our guest today?
Yes, so we have an alumni with us, Katrina Farber, and she's a recent graduate from the program. And after I give this short description about spatial analysis and Morgan follows up with some of the logistics about applying and so forth, we'll have some Q&A. And Katrina can help us shed some light on from a student perspective. But Katrina, let me give you a minute or two now just to tell everybody about yourself.
Hi, everyone. As Frank and Tim said, I'm Katrina. I just graduated from this program this last spring, so I am a very recent graduate. Really loved the program. It was really one of the best things I've done for my career. I currently live in Atlanta, Georgia, and work at the Task Force for Global Health, working in neglected tropical diseases. And spatial analysis work is really becoming integrated into nearly everything that we do in our programs right now. So it's definitely a skill that is needed and going to help with my career as we move forward. So happy to be here today and answer any questions you all might have regarding the program or you know, just getting through the next 2 years.
Thank you, Katrina.
Okay, so first I will go over our agenda for the call. We will touch base on spatial analysis industry overview, program details, curriculum, learn a little bit more about our online learning and student experience, highlight some of our faculty in the program. I will go over the admissions requirements and tuition and financial aid information. And then, as Frank mentioned, we will have a little Q&A and get to talk a little bit more with Katrina.
Okay, so let's get started here. So what is spatial analysis? Well, it really depends on who you ask and what their experience in this field is. We have some definitions up here. It's the interpretation of geographic information through the use of mapping software and statistical analysis. It builds on the foundations in epidemiology and biostatistics. And Tim and I have been teaching here at Johns Hopkins for those 25 plus years. And we really take more of a comprehensive view of spatial analysis to include components of spatial data, where you get this data from, what form is it in, how you work with it. Geographic information systems is another very prominent component of our paradigm. This is your mapping software. So now you have spatial data. Let's map it. Let's integrate it all together into one system, one software, and be able to map it. And maps are so powerful, as you'll hear me say in a few more slides to come. But that's not the end. because now we lean on the field of spatial statistics, which is still a fairly new field in statistics, to sort of go beyond the map, analyze the trends, and so forth. So spatial data, GIS, and spatial statistics are the three primary components of this comprehensive view of spatial analysis, and it shows up in our program and our teachings. Next slide, please. Spatial analysis, it has a long history, or rich history, I should say. You could say it started back in 1854, John Snow's famous map. If you take any kind of a spatial analysis or GIS in public health class, it usually starts out with this example. At that time, cholera was believed to be an airborne disease, and John Snow didn't really believe that. So what he did was he plotted all these cases of cholera. This is in London, the outbreak in London. And he plotted them and also put the water pump on the map where people were going to get their drinking water. And he saw, which is the map you see on the right and blown up view on the left. And these are the real maps. So they're not as pretty as the maps that you might see nowadays. But he showed that the cases of cholera were clustering around the water pump. And that was some of the earlier evidence to switch the paradigm that cholera was a waterborne disease and not an airborne disease. So it's a famous study using maps. Next slide, please. Well, you can fast forward a century and a half plus, and these are the kind of maps that we make now in public health research. This is just an example of a project Tim and I and others were involved in where we're mapping malaria risk, and we're showing you here malaria risk both in the dry season and the rainy season. The geography here is in Southern Africa, Zambia. And not only are we producing maps of malaria risk, but we're producing uncertainty in those maps. That's what the green maps are, maps of uncertainty. Where are we more or less certain about our estimates of malaria risk? And this is based on a long-going project here at the school collecting data on malaria in Southern Africa and talking about prevention and control efforts and so forth. Next slide, please. But you see spatial analysis everywhere, and maps are pretty much everywhere, so this is just an example of CDC's, influenza reports for the flu season, and just taking, an example between 2017 and 2018, and it's just showing you weekly views of that output, and it's communicated in terms of a map because maps, people love maps. It's a great way to communicate. It's a great graphic to use, and in spatial analysis the map is your graphic to go to because you're talking about spatial data with location information. So here we're just showing you statewide. The bottom right hand map, we include this. It was just an interesting article that came out in the New York Times about endangered species and the stuff we buy. So it's like your footprint in terms of what you're buying, the stuff you buy, and how that affects different endangered species across the world. So again, communicated via map. Next slide, please. Maybe one of the more recent, popular, historic, legendary maps was the JHU COVID dashboard. Back a couple of years ago. It's no longer updated or up on the site, but this was a dashboard at the time of the height of COVID that was the go-to piece to communicate. And in its simplest terms, it's just a map of cases, updated hourly, and just not only cases but deaths and other metrics and so forth, and some other non-spatial graphics on the right. But this idea of maps being powerful and communicating as a communication tool can't be understated. So that's an example that we can now point to. This is sort of like the Jon Snow of current day, the powerful of communication via maps. Next slide, please. So why spatial analysis? Well, we like to look at it as an added benefit, right? As scientists, we ask a lot about our data: who, what, when, where. Where is the spatial part. Okay, so it may not just be when it happened or who it happened to or how it happened in terms of health, but it could be where it happened, and it may vary based on where it happened. Risk of disease varies spatially or geographically. We can use those terms interchangeably. These are just some quotes from the labor and growth industry profile. Because the uses of geospatial technology are now widespread and diverse, the market is growing at an annual rate of almost 35%. I'm not going to read that second quote on the screen there, but that talks about the availability and the accessibility of spatial information, spatial data. Everybody uses it now, whether it's on your cell phones, whether you see it in different other media contexts. It's available to us now. So the idea is that a lot of people are taking opportunities of this, and this is generating new technologies, the needed for new technologies, the needed for people with this type of expertise in the marketplace and so forth. So it's really a growing industry. That's what these quotes are referring to. Next slide, please. This was an interesting article. What gets measured gets done, and that is so true. Okay, and there was a quote in this article here that leaders, and by leaders we mean leaders of government agencies and more local health departments, insurance companies, and so forth. These leaders recognize that there's an urgent need for more timely and more geographically specific data at the neighborhood level, or sometimes is what referred to at the census tract level. So not just summaries across the state, or even counties. They want to get more localized, more at the neighborhood level, to efficiently and effectively address the most pressing problems in public health, because everything's very spatially. So it depends on where you are, right? And getting at more of the where you are down to your neighborhood can be highly effective when addressing some of the most pressing problems in public health. Next slide, please. So careers in spatial analysis. So there are a number of career paths, both narrowly focused and more encompassing. Spatial analysis for public health can be used among other traditional health careers. So like I said, spatial analysis is like an added benefit. Okay, so you can bring that added benefit into whatever you're currently doing, or go out and be the new spatial analyst, that kind of thing. So possible job titles include environmental health officer, a GIS software developer, or cartography or visualization specialist, GIS scientist, geographic information scientist, geospatial data administrator, spatial analyst. These are all generic terms, but you kind of get the idea where this idea of being trained in this area really helps you embed yourself in different types of industry, or just building off of your current role in your jobs. Next slide, please. So if we track some of our alumni, right, the program's been going for 7 or 8 years. So we have alumni that are in the private sector, utility companies, the geospatial epidemiologist, consultant. We have a lot from CDC, and there's applications within CDC, sustainable energy and health, oncology, water and air quality, patterns of health disease, so all about surveillance. Some specific job titles: statistician, GIS data analyst, epidemiologist, faculty at schools. So we've had faculty at universities take this program, and they remain as faculty, but they get that added benefit of now being a spatial analyst, or having the tools to do spatial analysis. More in the public sector, we have people at CDC that take the program, Department of Homeland Security, Public Health Institute tracking in California, and health departments. We had someone from the Washington State Health Department, and so forth. We currently have a student now from the California State Health Department. So health departments are really where information like this could be really beneficial, having trained in spatial analysis. Next slide. So some of the program details. So we have a 2-year Masters of Applied Science in Spatial Analysis. And I'll go over sort of the curriculum like that. We also have a reduced program, just a graduate certificate in spatial analysis. And the courses, the spatial courses are the same between those two. It's just that the master's includes training in both epidemiology and biostatistics. But the whole program, whether it's certificate or the master's, it's more skill based and more sort of like hands-on working. It's part-time, completely 100% online. The lectures are asynchronous. It's like I said, it's more skills oriented, case studies, examples, hands-on learning, and we focus both on local and global issues. So the ultimate goal is to prepare students to address public health problems through this multidisciplinary approach, bringing in that added benefit of spatial analysis. Next slide, please. So this is the curriculum, and and you can get this online, and Morgan can share the slides or speak more about where this curriculum is located online. I'm going to highlight the spatial classes because we have 4 core spatial classes. So and Hopkins runs on not on semesters, it runs on terms or quarters. So that's why you see 4 quarters or 4 terms per each year. So this lays out the curriculum for the master's degree. And so the core spatial courses includes a 1 term on GIS, so learning the software. Term 2 includes this idea of spatial data technology. So the availability and accessibility of spatial data. Where do I get it? How do I work with it? How do I integrate it into my GIS to make the map? And once you get through those 2 courses, then we have 2 courses on spatial statistics. Now you have the map. How do we analyze that map? So we have a classic statistics course, applied spatial statistics on analyzing the map. And then we have another term course on spatial applications, which kind of brings it all together. Go out and get the data, map it, analyze it, and it's more of a activity-based course. Okay, so we have a GIS course, a spatial data technologies, spatial statistics, and spatial applications. And those are the 4 primary courses that make up the spatial component of the program. In the master's degree, it's spread out over 2 years. For the certificate, the 1-year certificate, you would take those 4 courses all in 1 year. So you'd be mixed with students in both the MAS and the certificate program. Another big selling point of our program is you see that last course at the bottom, year 2, quarter 4, term 4, integrative activity. So this is sort of like your capstone project. So for those in the 2-year MAS, and I'm not speaking to their certificate students now, for those in the 2-year MAS, you'll do an integrative activity, this capstone. And what we allow you to do with that is bring in your own data. Maybe you're working on a project at your current job, or you have access to data that from a public health problem that is of interest to you. We allow you to bring that data in and build an integrative activity around that, generate your own hypotheses, and then we guide you through on how to analyze that data, and you do that and write it up, and that's sort of your integrative activity. So it's 50.5 credits for the 2-year MAS, and it's 18 credits for the 1-year certificate. And again, this information is all posted online. Next slide, please. So Hopkins has a ton of experience with online learning. It became obviously more popular when COVID hit, but prior to that, we have a whole department on online learning, and we have 20 plus years experience doing this. So the courses are developed with high production value. Tim and I spent time in the soundproof studio going over and recording all our lectures. And there's also, as I mentioned, it's asynchronous, but it's not so much like, here it is, go ahead and do it, and we'll meet you at the end. No, there's a lot of activities that go on within a term to keep students engaged. We have what's called live talks, and we have sort of like each course has like 4 live talks. So every 2 weeks or so, Tim and I, we meet on Zoom like we're meeting now, and we talk about things. So we get to know students, we get to engage with students. what's working, what's not working. We go over homework assignments, over class lectures, and so forth. So it's a kind of nice free form, kind of just comfortable way people can all get together, get to know each other, and ask questions. But we also have teaching assistants that are available too that you can connect with outside of the live talks to get help on assignments and so forth. And yeah, so like I said, the recorded course lectures are there. It's provided asynchronous, so it's your flexibility allows you to watch the lectures and keep up as on your own pace, according to your own schedule. Next slide, please. So this is what's called Course Plus. This is our online format that we use for managing our courses. And this is not just for the online program. When Tim and I teach on site, we use Course Plus. So every faculty uses Course Plus, and it's this great learning system. So all the information is there. The course lectures become available there. The assignments are there. Anything that we've handed out in the beginning, the syllabus and Zoom links for live talks, the schedule for those live talks are there. And it also has something what's called a discussion forum. So this is an open forum which you can go to, and if you have a question, type it out. And students are encouraged to go there, other students, your peers, to go there and answer those questions or provide some assistance. We as faculty and the teaching assistants monitor this as well. So you'll be getting feedback, from Tim, myself, one of the teaching assistants, or your fellow peers in your course. So we really encourage the use of that discussion forum. So it's a great way to kind of communicate on the fly, as you go through the course. Next slide, please. Well, these are some of the esteemed faculty. Okay. You met Tim and I. We also have Elizabeth Topper, Rosa Crum, and Aruna Chandran that teach various courses. Tim and I teach the spatial series. Elizabeth and Rosa teach the epidemiology courses. Aruna teaches the some of the special topic courses, professional development, and so forth. And what's not on here is faculty from the Department of Biostatistics that will teach the two biostat courses for those that are in the MAS. So remember, the MAS has 2 courses in biostatistics and 2 courses in epidemiology, as well as some professional development courses. The 1-year certificate just has those 4 spatial classes, plus I think a journal club. But okay, next slide. I will hand it over to Morgan now to talk about some logistics.
Okay, sounds good. So I will talk about a little bit about the admissions process and requirements for applying for our programs. So to apply for the programs, you will be submitting your applications through SOFAs. So the original SOFAs is what we would need you to submit your application through for the MAS program. But if you are pursuing the certificate program, SOFAs Express is what we would need you to complete your application through. To be admitted into the program, we would need you to have completed a bachelor's degree from an accredited college or university. We would need transcripts, all college transcripts that you have completed. So I always joke, like even the art history class that you completed in 1998 for transfer of credit, we need that too. So all transcripts we would need you to, send in to SOFAs. For both of the programs. Your transcript should highlight that you have completed quantitative coursework, so the maths, the sciences, the biostats, things of that nature, and we're successful in those courses. We need you to upload a resume or CV, We need 3 letters of recommendation for the MAS program. You can upload up to 5. And for the certificate program, we actually only need 1 letter of recommendation minimum. Again, you can still upload up to 5. We would suggest at least one of the letters of recommendation come from a professor, a supervisor, manager, things of that nature. But your other letters of recommendation can come from anyone that has seen you in an academic or professional setting. Now to what I think is the most important part of the application requirements is the statement of purpose and objectives. This letter is what you use to introduce yourself to the admissions committee. So it should highlight your understanding of our spatial analysis through public health programs, why you want to do the program, why you think you're a good fit, maybe any experience you have related, and how you see this program kind of fitting into your goals. For our international students, we need a couple of additional things. So first, you may need to take an English proficiency exam. There are some ways that students get to be exempt from the English proficiency exam. And if you have any questions, I can always answer them one-on-one. But common ways are if you have taken coursework and the instruction of language in the coursework. So like if you got a bachelor's degree and the instruction of language was in English, then you may be exempt from taking the proficiency exam. Or if you're in certain countries, you may be exempt from taking that proficiency exam. Another thing that our international students must do is they must have a course-by-course evaluation completed by WES with all of their international transcripts. So again, we need all of those college transcripts. They will be submitted to WES. WES does the evaluation and sends them over to us. Okay. So applications are currently being reviewed. Again, they're on a rolling basis. Once you submit your application and have all of your documents submitted, we really try to get the decision to you within about 2 weeks. Our admissions committee is great with getting decisions out in a timely manner. So I wouldn't hesitate to get the ball rolling on your application if you haven't. However, the official deadlines for the application for the MAS program would be June 1st of 2026. And then for the certificate program, it would be July 1st. And then students will be starting in our fall semester starting in August. Okay, so let's chat a little bit about tuition for the program. The cost per credit for the program is $1,429. And then we have a MAS scholarship for $549. You do not have to do anything to apply for that scholarship. It's automatically awarded for all of our spatial students. So for the MAS program as well as the certificate program. So it brings the cost per credit down to about $880 per credit. And you're billed each term per credit. So if you're taking 2 classes per term, you would be billed, based on that credits. So about 6 credits. If you're taking, 1 class per term, you would be billed about that. The university does have a financial aid office. So if you have any questions and want to speak to them, that information would be available there. Students have also gotten some external scholarships. So for people who are listed or interested, I always suggest reaching out, and I can provide a list of external scholarships that students have qualified for. Let's see. Okay. And then I will kick it back to Frank to get us started with our Q&A. If you have any questions about the application process, definitely feel free to reach out at the email address below, and the QR codes are take you directly to the application. So feel free to scan those and get started.
Great. Thank you for that, Morgan. So now we just want to open it up. We have a small enough crowd, so if you have any questions about content, Tim or I are here to answer that, as well as our recent grad, Katrina. And just unmute yourself and ask away. Also, Morgan is available for questions about logistics and admissions and so forth. So we'll just open up the floor now.
And one note, if you're not able to chat, we do have a chat box that you can, type your questions in and we can read them aloud for you.
Sure. Please feel free just to unmute yourself and chime in with a question or a comment. One thing I didn't mention is, sometimes you get the questions, what software do we use? We use Esri products for the GIS. Esri is a company that makes the ArcGIS, ArcPro software. So you'll learn that, and we give you site license. We have a site license for GIS, so you get that software. We do all the statistical analysis, so the spatial statistical analysis will be done in the program called R, if people are familiar with that at all. If you're not, we give you sort of a primer on it to get you going and so forth. So R is completely free and downloadable on any platform. So there's no cost or license needed there. I think there's one in the chat, Morgan, that you might be able to address.
Yep, those are the two preferred English proficiency tests. Let me get you the link for our international students as well. 1 second.
And Morgan, you just put that link in the chat. Right. So while she's doing that, let me ask Katrina. So Katrina, why spatial analysis and what attracted you to the program that we have here at Hopkins versus other programs?
So, as I said before, I currently work at the Task Force for Global Health in Atlanta, Georgia. And one of the things that we do, my program does, is works with African countries on neglected tropical diseases and trying to determine how to eliminate those based upon the WHO guidelines. So geospatial analysis is really picked up as an essential component of those projects so that we can try to predict how much longer certain diseases are going to take given drug administration programs and how frequently those need to occur and all of that. The geospatial work has become essential to trying to make those types of predictions. And since WHO really wants to eliminate a lot of these diseases by 2030, every year that we go by, it becomes more essential to determine exactly what is needed in terms of surveys as well as the drug administration to reach those elimination goals. And so when I started with the task force, I already had my my MPH with a specialty in epidemiology. So I had that much background. But the geospatial analysis really started to integrate itself into every corner of the work we were doing. And we didn't have anybody yet who had, we had many people who had some skills in mapping and the program, the spatial analysis programs, whether it be, ArcGIS or the QGIS is the other big one that we tend to use. But nobody really had the detailed education about it. And so I started looking into it. And honestly, there weren't, because I specifically work in public health, there weren't a lot of other GIS programs that focused on the public health working of mapping. So that was one of the reasons I went with Johns Hopkins, even though technically we are associated with Emory University here, and I could have gone there for free, but they don't have a program like theirs. And so it was better to get the right education than just any education.
Thank you for that. There are GIS programs out there, but they're specialized and they're sort of like in ecology programs or environmental science programs and so forth. And one of the selling points is our program. Not only is it in health, it comes from Johns Hopkins, but it's integrated with spatial statistics, and a lot of these other programs are more just focused on map making and sort of analyzing the maps within the GIS software, which is limited. And so we take it out of GIS and build this whole statistical paradigm on analyzing using the tools from the field of spatial statistics. And that leads me into a question that was in the chat about, quantitative prerequisites for this program. So, if you have an MPH already, a Master's of Public Health, or another master's degree where you had statistics courses and maybe epidemiology courses, then the certificate is more attractive to you. But if you don't have that, or you might just had an undergraduate course in statistics and maybe or maybe not touched on epidemiology in another course, the Masters of Applied Science, the 2-year programs, provides the 2 years of EPI. These are introductory courses to EPI, and 2 years, not 2 years, 2 quarters or 2 terms of EPI, and then 2 terms of biostatistics to kind of get you up to speed to do the spatial statistics. So if you don't have a lot of quantitative background, then the 2-year master's degree will include that for you. Let's see if there are other questions in the chat. The person that asked that, Amy, let me know if that answers that question.
Can you hear me okay?
Yes.
Okay. Yeah, I have a bachelor's in public health. So, and I don't have any masters, so I just want to make sure that when I apply, would I be maybe rejected because I don't have a lot of that quantitative coursework to show, or how, do you have any advice on, are there programs maybe to get up to speed before applying?
So people might be familiar with Coursera, right? These are that online enterprise that provides free courses in a lot of different subjects. But Amy, you have a bachelor's degree in public health, so you've got the public health background enough to start the program, and I would certainly suggest a 2-year master's, so you get that 2 terms of biostatistics and 2 terms of EPI. And I think you would be an ideal candidate for that program. So I don't think you need to do any prerequisite work prior to applying, or even prior to starting the program.
Okay, great. Thank you.
Debbie, you asked about
can I add to that, Frank?
Oh, of course. Quick? Yes.
Because I just want to, as a student who went through it, yes, I had the MPH beforehand, but those courses will give you the information you need to have for that quantitative experience. A bachelor's in public health would be a perfect preliminary education to what you would be getting in this course. So I just wanted you to know that, what you need to know will be given to you in the coursework. The EPI classes are much larger classes because they include several different programs. And so the schedule is fairly tight with those because of the quantity of people that are in them. But the information and the education you need to be able to do the rest of the program will be included in those.
Perfect.
Okay. Thank you.
Debbie, you asked about, can I speak more on who teaches the spatial courses? Well, you have them here. So Tim's background is in geography, like you mentioned. So he teaches the GIS courses, the first course on GIS and the spatial data technologies course. My PhD is in statistics. I teach the 2 spatial statistics courses, the applied spatial statistics and the spatial data applications. And Tim and I jointly teach the integrative activity course. That's when you bring it all together. And for the 2-year masters, we also have 2 labs, GIS labs, scattered throughout the 2 years to keep people's skills sharpened in GIS and spatial thinking. And Tim and I also co-teach those. Do you have specific questions about any of those spatial courses? And Tim, feel free to chime in as well.
No, I think, Frank, we have a couple of those, we call them spatial analysis labs, the 2 credits. But we also have you have a journal club. We also have the online research and spatial analysis, other 2 credit courses too. They'll throw them in there as well as like more of a full filling in all the gaps is what we're trying to do.
Yeah, thank you for reminding me of that. So we have the 4 core courses in spatial analysis, and Tim and I split those, the GIS side and the spatial statistics side, and then together we teach sort of more these special topic courses. 2 are labs in GIS, and 1 is more about spatial thinking and so forth.
I know Pamela had a hand up. Oh, there it is. Back up again. Great.
You need to unmute yourself.
Hi. Yes, thank you.
Okay.
Hi, everybody. Sorry, I needed to join late due to a work call that went long. But thank you to the facilitators for putting this on. I am interested in doing homelessness housing research, and I think like geospatial methods could be a really cool way to sort of like put a lens on that research interest. And I'm sure that these questions were covered earlier, so I apologize. The first question is, will these slides be sent out, like the information slides, to us?
I'll send a recording of the call to everyone, so you'll be able to see the slides. And if you want the slides, I can send them to you as well.
A recording is also great. Thank you so much for that. My second question is it asynchronous, the program, and like what has been the success of folks who are working simultaneously while doing the program? Has that been the case? And also, Katrina, I'm also in Atlanta right now, so hi.
Well, Katrina's going to answer the second part of your question. The first part, yes, they are. The program, the lectures, the course lectures are asynchronous, so it's at your own schedule. But we do have these live talks where we hop on a Zoom like we are now with students in the class, and we have like 4 of those, like 1 every 2 weeks, just so it gets a little bit more intimate with students and not just like, here's the book, here are the lectures, go for it. So we like to engage with students. So we have those live talks, and those are scheduled. And anything we do, like a live talk or anything else, everything is recorded and posted. So even if there's a live talk you need to miss or something like that, you can check out the recording and so forth. So Katrina can help answer the one about working full time and doing the program.
So yeah, I worked full time for the task force while I was completing the program. I actually also still had a part-time job on the side while I was completing the program. So your success in this type of a program while you're working full time is highly dependent upon your own ability to manage time. And there's a lot of tips and tricks for that sort of thing that you can find on the internet. You need to find what works for you and make sure that you've integrated it into your life. It's a rough 2 years. The first year was fine. And then the second year, I started to slip a little bit. And then, of course, my program and work was highly impacted by what's going on with the government. When USAID was eliminated, we lost a significant amount of funding and had to let go a lot of people. And all of that occurred at the same time that I was trying to finish my integrative activity for this program. So plan well for your time management, but understand that things are going to come up. But what I'm going to tell you is that this team, Tim, Frank, Morgan, and RTA was Kara. If you guys have Kara, which I believe you would, amazing team to work with. And if stuff like that comes up, the biggest thing to do is communicate. They're going to help you through it. They want to see you. One of the things I loved about this program, Tim and Frank are going to have to blush a little bit, but one of the things I loved about this program is the fact that they're really focused on making sure you get the education, not just finish the program. So, you know, they want to make sure that you've gotten the information, that you've learned it, that you've integrated it into what it is you need it for, and not just, you know, finish an assignment or complete the live talk or any of those kinds of things. So, it is, I'm not going to try to tell you that it's easy to work full time and complete a second a master's level program. It's a lot of work and you have to dedicate yourself to it, but it's certainly possible. And at the end of those 2 years, it's very rewarding. This is, it is my second master's degree, but this I would tell you is the degree that makes my career.
Thank you both for those reflections.
Yeah, thank
And
you for the
also,
comments, Katrina.
Pamela, really quickly, I'm sorry, Frank, really quickly, Pamela, you were talking about trying to research homelessness. We work with a lot of data around migrant populations, which would be similar in a lot of ways. And yes, this type of spatial analysis is going to be highly impactful and useful in those those types of research projects.
That's amazing. And for like the research on migrant populations, is that through the task force or is that through this program? I just want to understand a little bit more.
The task force, my workplace does a lot of research on the diseases and how they impact the migrant populations that exist in those countries, because of course in those countries there are large populations that have to move with resources, mostly water, and it's harder to get, you know, the drug administration or even surveys done with those populations. It's hard to track them. A lot of them keep their where they live, where they're moving to, secret, so that they can try to prevent other people who would take resources from them from knowing where they are.
Yeah.
So yeah, we work a lot on that at the task force. But it would be similar in nature to working with homeless populations.
And Pamela, I'm not sure when you got on the call, but you know, we have something called the integrative activity for the 2-year masters, which is like the capstone. And we allow students to bring in their own data and form their own capstone, their own project around their own data. So that would be an ideal situation for you to bring in stuff about the homeless.
Amazing.
And the tools we provide would directly be applicable to a lot of questions you might ask about that. Also wanted to thank Katrina for some of the positive comments she made about Tim and I, and that really is true. What's important to us is you learning the material rather than you getting the grade that you want. You know, that's probably our biggest priority. And we also understand, again, this is Hopkins, so again, it's not going to be a breeze to go through either the certificate or the 2-year master's program. You're going to work for it. And but we understand, especially with our students at this point in their life, is that life happens, you know. So there are a lot of situations where we need to be flexible with deadlines and so forth, and we are, because again, our goal is not for you just to hand something in. We want you to understand it. So I'd rather give you another week or so on an assignment to really understand it rather than pressure you to get it in because, you know, the hot water heater broke at your house, or, you know, kids are sick, and which are examples of stuff we get all the time. And that's completely fine. So like Katrina said, please communicate with that to us up front and everything will be fine.
And I will note, you know, Katrina is a champion for completing the program in 2 years with 2 jobs, but the program can also be completed in up to 4 years. So if the 2-year time frame is too much, you can definitely stretch it out. We're, like Frank said, super duper flexible. We have a great program coordinator. Their name is Aiden, and they do a great job kind of working with students. You know, like Frank said, life gets in the way sometimes, and we may have to kind of shift your schedule, shift your course plan. And Aiden is great working with that. Again, our professors, faculty, super flexible and here to support you and getting the program done, not necessarily just in the shortest amount of time possible, but if that's your goal, we value that, but just in, you know, a time frame that makes sense for you as well.
Thank you.
Other questions or comments?
I might add one comment to all this. Katrina, thanks for all the nice things you said. And, you know, you had nice resources. You know, Frank and I do all we can to help you, as well as Kara and the admin team here too. But another great resource that maybe is not highlighted yet is your fellow students. You know, the MAS is, you know, it's all about applying these technologies. So, and everything you learn. So, but students come to not just learn a skill, they really focus on application of. That's kind of maybe the most exciting part, most rewarding part for me is watching this process go. But students have created these linkages and networks where, you know, we have a discussion forum, it's electronic board where things get exchanged, but students also do side networking too. So you're working with a group. And you know, it's one thing to get the problem set done or get the maps created, but it's also, it extends beyond into how are you applying it or what cool thing are you doing? And, you know, people are ingesting this and taking it to their workspace and other areas too, and sharing that. So that just broadens the experience for everybody. But I'm always impressed with the student networking component of this.
Other questions or comments? I think everybody that's left asked a question. If you have anything more. Okay, what I would say that if questions do come up about program content, the classes, you know, please feel free to reach out to Tim and or I. You know, our emails are easy to find, and we actually do respond to them. So if you have questions about the courses, send them to Tim or I. If you have questions about the program admissions application process, you know, Morgan would be a person to start with. And we'll get back to you on whatever you ask.
Well, thank you all so much for joining us today. Again, thank you to our program directors. Special thanks to our guests. Definitely gave a lot of, I think we have another last minute question.
Yeah, about AI, right?
Mhm.
So we are starting to try to integrate some of that. I'll let Tim speak maybe a little bit more on that if that's part of that one special course.
We get into it a little bit in the online research. We have discussions on it. Not so much the practical, you know, incorporating it and doing the actual, you know, nuts and bolts of bringing it in, but we study the research about it and we have a big discourse on different aspects of it. So.
Okay, Morgan, I think we can wrap up.
Okay. Any last minute questions before we go today? Not. All right. Well, again, thank you everyone for joining our call today. If you have any questions, definitely feel free to reach out. If you can't find Frank and Tim's email and find mine, I will point you in the right direction. And we look forward to seeing your applications come in soon. So thank you, everyone.
Thank you, everyone. Thank you, Katrina.
Thanks,
Thank you,
everybody.
guys.
Thanks again, Katrina. See you.
Yeah.